Now, I'm going to introduce to you Dave Vickery. He's going to be talking to you about how to be your own advocate. We've known Dave a long time, and he is a long-time patient, so he has a lot to say. Welcome, Dave.
Thanks, Marianne. Thanks, Bob, for organizing the second conference video or virtually. It's been really good so far for me, and I hope it has for everybody else. So most of my comments on being an advocate will be about you being an advocate for yourself, but I think they also can apply to you being an advocate for other people in your lives. So you may not be the patient. You may be helping support somebody who is the patient. And I believe that most of these comments will apply to that situation directly also. So most of us have a healthcare team. We have an oncologist, an endocrinologist, perhaps a surgeon, and of course, the nurses who help implement many of the decisions. So they are our healthcare team, and I believe that their goal is to help give us the best quality of life for the longest time possible. So that's the focus of that healthcare team. And they have a set of very powerful tools available to them. Scanning, lab tests, drugs such as sandostatin, lanreotide, Zermelo, a host of other pharmaceutical solutions. They have the ability to do surgeries, embolization, radiotherapy, some of the cutting edge techniques, PRRT. And when I think about that, I break it down into two buckets. That part of their activity and part of how I access the healthcare professionals are in the process of evaluating where I am to help determine, assess, and understand what is going on with my tumors and how it's affecting me. And after that's been established, then they have to determine how to react to what they've learned, how best to treat me, how best to provide a better quality of life and also extend my life. So that is what your healthcare team is actively involved with. How do you become part of that team? Because it's really necessary that as the patient or the support person for a patient, that they hear and feel your influence on what's going on. That's why it's important for you to be an advocate for yourself or for someone else. You need to join that healthcare team. You're a really important part of it. And your input into the evaluation process and potential treatments is really vital. They need to know your feelings. They need to get your input into those various functions. So how do you do that? I think one of the prime ways is to respect their time. And therefore, that means when you're going to an appointment, you need to prepare for it. You need to spend some time looking at your past labs and understanding what the data means, or at least understand what the data is so that you can ask them what it means. And you need to do that before every appointment because that respects their time. And they also then know that they probably need to be responding to you because you're prepared, you're knowledgeable about your situation, and they can be better prepared to help you. So when I go to a doctor appointment, I typically ask myself before I go, what do I want to have happened at that appointment? When I leave, what do I hope the outcome is? What decisions do I want made? Do I want to understand of various tests that I've gotten back? Is my serum 5-HIA, the change in that, is it important? Is it critical? What tests should we do next? Are there tests on the horizon that we should be considering? When should I do another gallium-68? I've read about PRRT. Is that a possibility for me? Why or why not? So these are the thoughts that you need to work through before you go into the doctor's room and perhaps jot them down. If possible, it's great to be able to share these thoughts or these outcomes that you wish with your doctor prior to the meeting. Many medical situations now have the ability to leave chats or leave emails. And I think that's a great place to let the doctor know the questions you have going into the meeting rather. So I think it's great to be, I'm sorry. I forgot to shut my phone off. Yeah, so I think it's great to set those expectations up front and to let people know that, let the doctors know that you've got expectations and that you've thought through it. So I know that you've been advocates in the other parts of your life. You're sitting there going, I'm not sure I can be an advocate in that way in my healthcare situation. And I'm going to give you a couple examples where I believe you will see that you have been an advocate for yourself in other areas. And I think it translates very well to the medical situation. So I'm going to give you the first example, and these are real life. I'm a little bit of a storyteller, so bear with me. And I'm going to call this the Kyle cheeseburger issue. So about 10 years ago, I spent a lot of time with my brother and my two nephews traveling for a couple weeks. And Kyle, being an 8-year-old, loves cheeseburgers, but he only likes Swiss cheeseburgers. And he was pretty focused on getting just Swiss cheeseburgers. And many of the restaurants that we would go to would almost ignore the Swiss cheese part and deliver him a regular American cheeseburger. And Kyle, being 8 years old, was a tremendous advocate for himself. He would send that cheeseburger back. It's not what I ordered. I asked for a Swiss cheeseburger, and they'd have to remake it. After a couple times, he got into the pattern of, as the waiter left, he would say, "Can I verify what I ordered?" and have them repeat it. And many times he would catch the error. There's an example of where he, in a very simple way, was helping the person deliver what he was expecting, and he was being his own advocate. Another example I've got is, as my mother aged, we helped her in a lot of areas. She had a tree nut allergy. And when we'd go to a restaurant, she would sometimes not remember to ask the question about, is there any nuts in this product? And we would prompt her on that. And many times the server would say, "Oh, let me check." And then after a few minutes, there would be no reply. And we'd have to ask that question again. And once in a great while, we'd have to escalate that question to a manager. But we, as loving kids of my mom, were not going to allow her to be exposed to tree nuts. That would be a real problem. And we had to advocate for her. And I think the same thing goes through in our situation. There are some critical situations that you just can't pass by. You have to advocate for yourself to ensure that you're getting the best treatment and the best outcomes possible. Now, let me give you one that's a little closer to our world. And after I'd been on Sandostatin LAR for quite a while, I arrived at the hospital. I was going to the injection area, the infusion clinic. And I noticed that the nurse who was going to give it had just laid it on the counter, and it was laying there. And I'm sitting there just fixated on this thing, just sitting there. And most of us probably understand that you need to keep that moving. You don't want to shake it. You want to rock it. You want to keep the mixed LAR moving prior to injecting it. And I finally, after maybe 30 or 45 seconds, I said, "Ma'am, I can rock that for us if you want me to." She said, "No, it's fine there." And I said, "No, I don't believe it is." And it was a bit uncomfortable for me. And she said, "No, it's okay. I give a lot of these." And I said, got pretty firm with her right away. And I said, "It needs to be rocked. I know what I'm talking about. Either we start rocking it or I'm going to refuse the shot." So that's a pretty dramatic escalation in what we were doing. But I think it was needed. I did not want to get a bum shot. I did not want to get a shot that was going to be more painful than it needed to be. And I certainly didn't want to get a shot that wasn't going to be effective. So those three examples are how you already can be advocates in your life, and you need to apply that to your healthcare situation. Kyle's Swissburger example, my mom's tree nut example, and then my real life Sandostatin example. So hopefully this little bit of a talk has encouraged you to be an advocate for yourself, especially with your healthcare team. And you have a role there. You need to be that advocate, and you need to prepare to be that advocate. Don't let that opportunity of a doctor's appointment slip away without knowing what you want the outcome of that appointment to be. So, just in a quick review, we've talked about what it means to be an advocate, how your healthcare team needs you to be your advocate. They need your participation. A couple examples of how you might be an advocate in real life, and that can translate over to your medical situation. So, thank you for listening to me. I hope you have a great rest of the conference, and I hope you get the cheeseburger that you really want. Thank you.
Yeah, hi, Dave. Thanks for that. If you want to just hang out for a minute, looks like we don't have Dr. Gerstein yet, and I had a couple of quick questions that I thought maybe the audience would love to hear answers from you.
Sure.
First off, you were talking about advocating for yourself,
Right.
and we've been doing this for a few years now. A lot of folks may, as you mentioned, be a little uncomfortable. Do you feel that the medical community, as in general, is more receptive to self-advocacy than they used to be?
Yeah, I think they are, Bob. And part of that, I think, is the average patient going to an appointment is probably a lot more knowledgeable in their situation than ever before. Two things. They certainly can get a lot of information off the internet and through forums like this. NCAN is a great dispenser of accurate information. And I think a higher percentage of patients are probably better informed on that area. Also, I think with the advent of many of the apps that hospitals or medical systems have, you can avail yourself of your testing much more readily. You no longer have to call the nurse and say, "Can I get a copy of that? Can you fax it to me? Can you send it to me?" Most medical systems now have pretty rapid reporting of your lab results. And one that I'm on actually helps me chart those. So I can look and see on the various labs that we're following for my condition what the progression has been. And if I have questions about that, that's perfect to take and show the doc at the appointment and say, "Here's what's going on. What do we think of this? Is this something we need to be aware of?" So I do believe that healthcare professionals, at least in my experience, are not at all reluctant to have you as a patient involved in being an advocate for yourself. I think they almost expect it, and perhaps in some ways they rely on it.
Yes, yes, yes. I appreciate that. I think we've seen some progress in that, and it's a good thing. So, folks, don't be afraid to advocate for yourself. And I know, Dave, you're going to be around the conference here and there during the day, right?
Correct.
If people want to look you up. Also, you can get Dave's contact info off of our website, netcancerawareness.org. Go to the chapters tab, and you can reach out to him via email. There may be a phone number there as well.
Yep.
All
Glad
right.
to take calls from anybody, especially those in Michigan. Love to chat with folks here in Michigan and elsewhere too.
Perfect. Well, I see Dr. Gerstein is with us. So, Dave, thanks for your time, and we'll see you later.
Thank you.